Ladies and gentlemen across the continent, I want to welcome you to the IHA Live today. And today we have a special guest named Dr. Patricia Holl, who has more than a decade of experience in comprehensive chiropractic care for pain management, rehabilitation, pre and post-surgical conditioning, and general wellness. She's been with Yellowstone Naturopathic Clinic since 2006, where she works with patients to relieve musculoskeletal pain without drugs or surgery. She coordinates patient chiropractic care with other therapies, including alternative and allopathic, for patient benefit. She frequently lectures to medical professionals and the public on chiropractic medicine and the benefits of appropriate stretching and exercise for pain management. She also instructs patients in the ergoscule method of postural alignment. Today, we're going to be hearing from her about equine chiropractic. We're going to be learning about movement, and we're going to be taking away something that each of us as horse owners and enthusiasts can do with our horse. And with no further ado, I'd like to introduce Dr. Patricia Holl.
Okay, so hi all. Can you see the PowerPoint on the screen, everybody?
There you go.
Right. Okay. I need to update that, obviously, because I have more than 2 decades, approaching 3, as a doctor. But so a privilege always to have any association with the International Horsemanship Association and to be a part of this. Special thanks to Farrah Green, Andrew Turnbull, Lisa Rask, and everybody who made this, made this happen. I speak all over the country. I've spoken, in other parts of the world as well. And the big thing that I want to talk about tonight is really equine joint mobility. All right. We all know that we need to be moving, right? It's so important to move, but we don't know really why. But today, at the end of this conversation, we're going to know why we need ourselves, our animals, to be moving because of the deleterious effects of immobility. So I'm going to jump in, talk a few minutes about what happens when joints stop moving. And then I'm going to ask Farrah to talk a little bit about what happens when, some methods to, to promote movement. I just want to talk about Friedrich Nietzsche, who was this wonderful German philosopher and scholar. He died in 1900, but he said, he had a great quote, which is one of my favorite quotes on the planet. He said, "And those who were seen dancing were thought to be insane by those who could not hear the music." And I love that because as a chiropractor, people think chiropractors are insane because they crack bones, right? Can you crack me? I'm out. Well, that's not what we do. It's all about the neurology and about restoring motion. And so we're hearing the music and everybody else just can't hear it. And so we're considered insane. So this is just a favorite quote of mine. So today we're going to talk about hypermobility, movement, touch, and the brain. And most importantly today, I want to talk about what happens when something gets stuck. All right, that's so critically important because it's everything. So we'll jump right into that, and then I think Farrah is going to segue into how we can restore movement. How can we do it on our own? How do we do it at home? All right, we'll talk about touch. When we touch our tissue, our own tissue, when we touch somebody else, or when we touch our animals, we are deforming the tissue in the body of the subject that we're touching. When we touch something, we engage receptors, we engage neurology. And we'll talk about chiropractic later, but what we really want to discuss is movement and the brain, because this is a neurologic conversation. So if anybody wants to interrupt me at any time, please do so. This is a conversation and we're here to talk. So journey with me, if you will. Okay, movement is critical to our neurologic survival, to our neurologic evolution. We have to move the parts. And so I want to impress upon you something that matters right up front. Movement is different from motion. Everybody here can move their necks, hopefully, right? You can all just whirl your neck around and move it. But that doesn't mean that the joints inside the neck are motioning. If any of you have ever gone to a chiropractor and had your neck adjusted, you'd hear pop, 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 right? And feel that. Well, that's what chiropractors do. We restore motion to the joints. When we restore that motion to the joints, we're engaging receptors. And then vitally needed information is provided to the brain. So movement, and I'm going to sort of interchange these words, movement and motion, in this conversation. But I'm talking, if I say movement, I'm talking about joint motion. Okay. So joint motion is critical. All right. Whenever a joint is reduced in its motion, it gets what I call a stuckage. That's my medical terminology, stuckage. It's very sophisticated, but a hypomobility, right? One joint. All right, let's talk about what happens when a joint gets stuck. What happens when one joint, just one joint in our body? Now, I assure you that you look at your horse, there's never one joint that's stuck, right? But let's just suppose only one joint in your body gets stuck. What happens? Everything happens. And I'm going to tell you, and you're going to know what's going on. So Dr. Emil back in 1982 said, loss of motion in a joint results in changes in every structural component of the joint. All right, loss of normal motion. All right, this isn't a great big injury or anything, just one little adhesive joint. All right, your stuckage in the neck or a stuckage in the back results in changes in every structural component, from the bone to the synovial fluid, from the spinal cord to the ligaments. All right, and of course there are biomechanical outcomes of a stuckage. So what I'm going to do right now is the next couple of slides is I'm going to show you what happens with one stuckage, right? And so just consider the body and all the systemic effects of many, many joints being stuck or adhesive or just not motioning. All right, of course we have ligamentous damage, we have weakness in the muscles, and that leads to misalignment, that leads to instability, that imposes a great burden on the joint. Now, when the joint is burdened, that results in micro traumas, and that can form adhesions, fibrosis, ultimately osteoarthritis. Mm-hmm. And of course, there are biomechanical outcomes, as we're talking about. And then what do we do when like we have a sprained ankle, for example? We compensate, right? We lean on the other side of the other foot. We just make all these compensatory changes. And our horses are no different. So if I interchange, I'm a human chiropractor too. So if I'm talking about the joints, I'm talking about us, I'm talking about the horses, I'm talking about the bulls and the dogs and the cats and everywhere. And as this stuckage is not addressed, as a hypomobility progresses, then other factors start to ensue, such as this compensation. If your sacrum is stuck, and the equine sacrum, incidentally, in the pelvis. So the sacrum is the middle bone in the pelvis. When that gets stuck, boy, oh boy, that can subluxate the ilium, which is the side bone of the pelvis, the femur, which is the back leg bone of the horse, that can get altered and compensated, and it can just, it can just go down from there. So we know, that there are biomechanical effects, right? We know that there are structural changes that happen. There are movement patterns. All of a sudden, your gaits are altered. You're not jumping well. You're not taking your left lead. You're just not. There's something amiss, right? So these are all the biomechanical effects, but immobility goes far beyond the biomechanical outcomes, right? There are systemic effects because our body is a universe. So when a joint is not motioning, lactic acid builds up, then oxygen delivery is declined and diminished. And fluids build up and edematous scenarios ensue. And this impedes circulation, and then it stimulates our pain receptors, our bradykinin, our substance P, all these chemical variants that we have in the body. So what then happens is that you have a chronic dysfunction. You don't attend to it. You don't restore that motion. And that leads to the muscle starting to be impacted. The muscle contracts, it shortens, right? It tightens up. And then that causes ischemia, which is a lack of blood flow. The oxygen attaches to the hemoglobin. And so if the blood is not flowing, the oxygen is not flowing. If the oxygen is not arriving at its destination tissue, you cannot initiate repair. And then, then the nerves can't transit, and nerves don't just carry messages, they carry nutrition. Oh, I'm sorry. Did someone say something?
Nope, you're okay.
Okay. So I want you to understand that there's a biomechanical aspect of a stuckage, of an immobility, and then there is a systemic problem that also ensues. So the sequela of events can become catastrophic because it is comprehensive. And then our bodies, reach for an increased metabolic demand, and they cannot get that demand. And we go into what's called an energy crisis. So without movement, there is a lack of blood flow. With a lack of blood flow, you get a lack of oxygen delivery. And then you get a shortage in adenosine triphosphate, which is, the currency in the cell, and it goes down on a cellular level, and the body goes into an alarm. And then you get this big compensation where the body starts to lay down adhesions and fibrosis and arthritic scenarios. And then before you know it, you have a lame horse, right? From one stuckage way, way back there, way back there when the horse just tripped in a gopher hole. And all of a sudden something was wrong, or the saddle was thrown on, too vigorously, and you jumped on and you didn't permit yourself to just arrive onto the saddle, and that subluxated the thoracic spine, and all of a sudden you have a lameness, right? Or you have a rib out, or you have a breathing problem. So all of this is what happens with an immobility. I mean, I don't want to bore you with the biochemistry, but I want you to appreciate that acetylcholine, you get excessive releases of that. You get muscle fiber tension. And these are sensitizing substances, and they interfere with our nerve flow. And they interfere with the whole cycle of health. This morning I was listening to a presentation from a gentleman down in Arizona about the lymphatic system. And he was talking about cellular debris, and that we all have cellular debris, and our lymphatic systems are what pump that debris out of our bodies. And really what happens is that the lymphatic system can't work in the equine if there's a stuckage. So if it's your horse is at 100% day one, and then it has a stuckage, maybe it's at 98.6% the next week. And then all of a sudden, exponentially, it starts to fail. So mobility matters, all right? immobility, that stuckage leads to inflammation, it leads to pain, and secondary and tertiary scenarios, and it causes trigger points. Again, active muscle spindles. The muscle spindles are receptors in the body. So I'm hoping by now you're starting to appreciate that this is a big, fat neurological problem. Right? It isn't just architectural. It's a systemic scenario. This is my favorite slide, but it's so verbose. I don't want to get too crazy with it, but appreciate that the bone resorbs. You have collagen mass that declines. The proteoglycans fail. Water content is reduced. Everything happens when a joint is not moving. One joint, remember, right? One single joint. Now, who has one joint out? Nobody. No horse, you know. We all have stuckage everywhere. So, so this is what ensues. Now, the discs in the equine are particularly vulnerable because they're dependent. The discs have to have movement for their survival and for their nutrition. So unlike the human, right, our spines are vertical. Equine spines are horizontal, right? So there's a difference. And so we then put a saddle on the equine spine, and then we sit on the equine spine, and then we ask the equine to run barrels or jump and appreciate, if you will, the burden on that spine, right? And so why is there immobility? Because the body recognizes, the equine body recognizes, wow, these ligaments and these tendons are being burdened so much. How can I keep this animal upright? I know. I'll speed up my bony matrix and I'll lay down adhesions, or I'll lay down fibrosis. And so it speeds up its fibroblastic matrix and it lays down adhesions and fibrosis until it lays down arthritis, just so that there's bony support there. So it is a great intent that the body has when it is burdened. However, it also has the downside to that, right?
Wow.
Is that making sense? Am I going too fast? You okay?
Well, it just seems like, oh, I hope this isn't happening to my horse because I
Right.
ride him, right?
Right.
I find it pretty fascinating though, Dr.
Wow.
Holl, that you're saying that when you're putting a saddle on the horse's back, it's actually laying down adhesions for protection.
Yeah, and it is for protection. That's a great observation. You know, if I asked you to put a football, what do they call those things that they put on their shoulder pads?
Shoulder pads.
You know, if I asked you to put on shoulder pads that a 350-pound football player wears on your shoulders, would there be a burden? Of course there would.
Mm-hmm.
Of course there would. And so that's what happens. So my body, if I were wearing them, I'm 118 pounds. If I put on a 350-pound football player's shoulder pads on my body, and ran around the block 5 times, my body would start to say, wow, how can I hold her upright? So it's immediately going to speed up that matrix. It's immediately going to say, how can I make you stronger? And the fastest way is to form adhesions. The fastest way is to form fibrosis, and the fascia builds up. And ultimately, if I did that every day, and for years and years and years, I'd faint. And after I fainted, I would realize that my body would be laying down, arthritis, right? It would start to lay down even bony materials just to keep me upright. And that's what we do. And that's why, Farah hopefully will talk about treeless saddles and different things and alternatives that we can do that's more forgiving to our horses, because I hope we're all, I know the Pirelli, is so magnificent, in that thinking and just in the objectives that they have, and a different way than, let's say, the old cowboy of Montana, who's throwing on 5 blankets and, jumping on with spurs and, packing the horse to go up mountains and down. And I'm not judging anything here. I'm just making observations, right? This is no judgment. So anyway, so immobility is a burden, all right? And it does lead to chronic stress. I'm going to jump over there. We don't really need to talk too much about biochemistry because I think you're getting the idea. All right, there's a buildup of arachidonic acid, and that pushes us into an inflammatory state. That it impacts our cellular communication, our gene transcription. But I just want to mention this. When I'm talking about a joint stuckage, in a joint, there are bones, there are ligaments, there are discs, muscles, tendon, fascia, dura, blood vessels, nerves, and then there's blood supply. So you want to consider how long has the horse been immobile? Has that joint been immobile? How intense? Is there an injury? Is there a postural burden? Do you have a lordosis in the back? And of course, the outcome, what is the outcome? Pain.
A lot of bad things.
Yeah, all sorts of, altered gait patterning. Lisa was talking last night about patterning. It was a really great descriptive. You get adhesive buildup and more immobility. So before I break it down through neurology, you all are starting to understand that immobility matters. And of course, we know that we need to move, right? We need to movement, but I'm hoping that Farah might jump in now and share with us some ways in which we can do this at home with our own horses. Would that be a fair segue?
I think that'd be just fine, Dr. Holl. And I think it's important to understand too, like you said, that, and please correct me if you feel that I'm wrong, but people think horses in nature are perfect, but they are really not. A lot of times they're right-handed or left-handed, just like people. And so they have a tendency to, always prefer one lead if there's not something that's causing them to be more equal. And the same way when they eat, this is actually something I've noticed quite a bit of, and that's why it's so important, especially young horses, but horses of every age, get out and move as much as possible while they're eating, because just standing and eating hay off the ground, horses often choose one foot over the other. And if they can consistently have one foot in front of the other, then you'll end up with a horse with a club foot that was not actually genetic, but it was because they constantly have one foot back and one foot forward. They're stretching the tendons in the back of one leg, and they're relaxing the tendons in the back of the other leg. And so it's not just because of us that these immobilities happen. And actually, of course, if horses are ranging over long distances, then they're more likely to be equal. But it's not always the case. And I think we're going to talk about this later too, but it doesn't matter what age that your horse is at, you can always help improve their mobility. And the more that you get circulation going to these joints, like what Dr. Holl is saying, the more flexibility, the more mobility that they'll have in each one of these joints. So I do have a little video that I can bring up here. And see if I can get my participants on there. Okay.
Who's the beautiful yellow Mino?
Okay. So this is actually, I'll go back to that one, Andrew, for sure. So this is actually a whole bunch of different videos that I put together that I thought would be a great representation of, yes, you can physically take your horse's legs and pull them, but imagine if somebody was doing that to you. You would have to give them a lot of feedback. And of course, you can do that with your horses, but I would prefer that my horse tell me exactly where they're comfortable with their stretching, and you can actually help them and teach them to do horse yoga. And so that's actually, I'm going to show you a few segues into that. This is my beautiful horse, Caesar. He is 24 this year. And
Hey,
I know, right? And
that's great.
Andrew knows Caesar. He actually was extremely stiff as a 5-year-old. And it turned out that he had a fractured knee, and his feet were, his tendons on the back of his legs were very contracted. His heels were about the same length as his toes, and his knees were almost facing each other. And it was a combination of shoeing at a very young age, and I think lack of movement, and teaching to trot in a teeny tiny little trot and having this be the only gait that he did. And so I actually spent a lot of time with Caesar. He's very, very strong, as you can see, but he didn't have the flexibility and the mobility in his joints. And so I taught him things like, this is something that most people reserve for saddlebred horses or Arabian horses, but it's good for every horse to learn to park out like this or stretch out. And then you can even exaggerate this more by feeding them a cookie down here, and you can see how far that he can actually stretch there. And that did not happen overnight. That was a long journey. But even just being able to ask your horse to put their head in between their legs. But you'll find if you try this at first, your horse might be trembling on their front legs. So don't, go directly to this. Start out slow, teach them to park out first, go to the level that they're comfortable with. But this is one of the biggest stretches that has really helped this horse. And again, this horse did this when he's 24 years old. So
Oh, that's great.
Any horse can do it.
Hey, Farrah, to back up a little bit, because we came on with the horse already set up.
Mhm.
How would I set him up for parking out?
Yes, and actually I have a full video
Oh, okay.
of how all of these things. These are just clips from my videos.
Mhm.
I have a full video of how to teach all of these different steps, but since we don't have all the time tonight.
Okay, fair enough. So I can find it by, from you then if I want it, right? Yeah.
Yes, absolutely. But basically just teaching one foot at a time and keeping the hind legs still, and rewarding every little try that they do. You saw there, and this is just one thing, I taught him to keep his hind feet still, and as I'm gently leading him forward. For that
Okay.
stretch. Yep. And there's, like I said, there's way more way more information on that. So then one of the next things is the Spanish walk, or just lifting and holding their leg up. And they won't do this to this extent in the beginning. They'll just lift their leg and hold it up, which is actually a great balance exercise. It's just like us doing the tree in yoga, but just holding the leg up, even at a relaxed posture, and then getting to the point where they'll actually hold it up and out. And you would be amazed, this horse could not even go past this point, and now he has a pretty spectacular reach.
Yeah.
I want to interject something right here. What Farrah's talking about now, and balance, you cannot imagine the surges of neurology that occurs when you stand on one foot as a human. And that's
Really?
something I work with our patients, all my human patients, all the time. How to improve the strength of your brain, because the brain just is an organ, and we decline because we don't and we don't use the muscles in our body as we did when we're younger. But standing on one foot, if you just stand on one foot and you try and balance yourself, you can see how challenging it might be. And for Farah to have the horses do that, the same neurological principles apply. Critically important. If you don't know how to do any of these things, you don't need to contact Farah, contact the professionals that are doing this, and then, you know, written the book already, and they can educate you and take their courses and train you further in that. But balance is another thing that we're not really talking too much about, but I love seeing it because it's so critically important.
That is really interesting, Dr. Holl, about the balance on the one hoof, because often when you're training this kind of thing, like here, I'm teaching him to hold one hind leg up, and it's amazing to me how the horses at first sometimes they'll lift the opposite leg. Even if you're touching the one and they understand what you want, it's as if their brain doesn't cross-reference it properly.
Well said. That's precisely said. And just the health of the brain, you know, is impacted so significantly with challenging those balance and that proprioception. So really important stuff, guys.
That's really interesting. I won't take too much more time, but this is just lifting one hind leg and holding, lifting the other hind leg and holding. And before you, especially with babies, if you're going to ask them to hold their legs up for the farrier, I think it's just rude to even attempt to lift their legs up before they learn to balance on 3 legs. And here's Caesar. This is a more exaggerated, but you can start with something very low and then slowly build up the height. And it took him a long time to be able to get to this height. Some horses are very, very flexible, but if you eventually want to do lead changes or fabulous passage or piaffe, if your horse does not have the mobility and the flexibility to do it, then they can't do it. Plus it makes them not afraid of obstacles, so that's always good.
So Farah, there's a fundamental thing here that is new to this is new to me. I've been taught to help my horse stretch, doing myself, and of course I have to move with him slowly, because just like you don't want somebody to stretch you without you moving, but you're really teaching your horse to do the stretching, and that seems to be a safer alternative. Is that kind of where what with the underlying why?
I like feedback from my horse as much as possible, and I've done, you know, you can stretch your horse, it's okay, but you have to be so slow and so careful. And I would rather have them tell me exactly how far they feel comfortable and how far they can go. I just thought of a couple more things that I didn't put on this presentation, but if you have a pedestal, just stepping 2 feet up on the pedestal is an amazing back stretch for them.
Wow. My horse loves that. I'll ask him all the time. Great.
Right. And it's so easy, you know, once they understand, they get up there and like, oh, this feels great. And it's a mental stipulation. The same, you know, we don't really think it's of value, but just putting their one hind foot. I do have a video of Caesar doing one hind foot, taking it off, putting the other hind foot on, taking it off. And this develops a height in the hind legs, putting both hind feet on. And this is a huge hamstring stretch. It's like downward dog for people. And so, like you said, Andrew, I would prefer that I don't manipulate the horse, if possible, that they do it as much as they physically can, and they tell me. And by using treats, I'm not saying it's the only way, but if a horse will not reach to the left because he wants a cookie, then
something really out. Yeah, because the
Right?
motivation is definitely there. I know we call them carrot stretches because you can set them up, right? But I think this is really I'm seeing this for the first time, how to encourage your horse, and of course you're building a relationship as you get them to move these various parts, but how much more powerful it is and safer with regard to helping with their movement.
Yeah,
Well, if I can add something, Farah, may I? We're talking about active versus passive range of motion. Passive range of motion is when I have someone else move my bicep for me. Active range of motion is when I do it. So what Farah is talking about is active range of motion, asking the horse to do the work. Now get back to that. So think back to that immobility. When the horse starts doing the work, the horse is motioning his own body, her own body, right? And so that is what we're driving home tonight. And that is joint mobility. They are moving a muscle, so they're moving a joint. And the more they can do it themselves, obviously, the better.
Fabulous. I'm so happy, Dr.
No, it's great. Good stuff.
I have just a couple more little videos if that's interesting, and then I'll go ahead and turn it back to you. I was thinking about this, and there's a lot of so many things that I would like to do in this, but so just when you're at the standstill, just asking your horse to stand with their head lower than their withers is a huge top line stretch. And if horses are used to just standing with their, maybe they're sleeping, they're relaxed, or even eating a hay bag with their head up, that is a posture that is promoting the underneck. It's not promoting the top line. The reason, horses should have great top lines because they eat grass all day, but some of our horses don't have that opportunity. So, and then also carrying the weight of the rider, like Dr. Holl was saying. If they're used to carrying their head above their withers with a hollow back with the weight of the rider, they're just going to break down. All their weight is on their front end. Their spinal process come together. And I'm sure you can elaborate on that. But as they lift their back up, then they separate their spinal process and they relax. Their circulation is so much more fluid and open. So people think that they have to do all these things in motion, but there is a value to first of all teaching it at the standstill and exploring the range of motion at the standstill before you even begin the motion. I don't know if you have something to add to that, Dr. Holl.
Well, just what Farah was talking about was a situation called kissing spines. Have you guys ever heard of that? That's when the spine is processed. The horse goes into an extension where extension, when I say extension, I mean, that's as though you and I are doing a back bend, right? So when the horse's head comes back like that's an extension. So what Farah's talking about is a real flexion. Most horses, naturally in the wild are in a state of flexion with their head lower than the withers because they're grazing. Right. But, we keep some of our horses in an arena and they don't have that opportunity. So what she's saying is there are ways to do that on our own. And that's what we're trying to talk about tonight. What happens and what we can do about it. So these are wonderful videos and great information, hopefully that you can extrapolate some information for your own horse in your own home.
And just teaching them, like this rider, this is the first time this horse has traveled with his back up, and he's experimenting with all these different levels with his head. Ideally would like his nose to be out and relaxed, but I'm just pleased that his top line is up and lifted, and he's really experimenting. Here's a way that I was teaching this horse online. First of all, we use the cone to teach him to lower his head on command, and then being able to do it at a distance, and then being able to do it in motion. These last couple videos are just some lateral maneuvers. So doing like a shoulder in is helping your horse learn to step in underneath with their hind leg and have a consistent, the more they step underneath with their hind leg under the weight of the rider, the easier it is for them to carry the rider, and the healthier their body is while it's moving. It's really hard on their back when their hind legs trail behind and all of their weight is on their forehand, your horse, it just takes years and years off of their life. Doesn't mean they always need to have their head down. Doesn't mean they always need to have a bridle on. But what's amazing is if you teach your horse to do these things, they will find themselves going to that posture by themselves at liberty, or they will just find more comfort in it. Here's a little example of haunches in. It's a more advanced example of the horse carrying the weight on the inside hind. I'm sorry, on the outside hind. This is just a really simple idea of a shoulder in and a leg yield. So this is my mother, Echo, just gently walking beside her horse and asking him to move sideways over as she was walking. And it just makes the horse more aware of where their feet are, and learned, if you just walk your horse often, they just bend left and right because they're pulling themselves along with their front legs. By teaching them these little lateral maneuvers, like here was Echo doing a little bit of shoulder in, they learn to push themselves along with their hind legs instead of pull themselves along with their front legs. And it makes a complete difference in their physiology. And the last clip, and then I'm going to turn it back over to Dr. Holl, is Wesley. And this is a video of a school halt. So you'll see I'm asking him to lean on his hind legs. Look at the amount of weight that's on his hind end right now. And when people talk about, doing a half halt and shifting the weight back by just teaching it at a standstill, look at the pelvic tilt that you get out of this. I heard you mention earlier the pelvic tilt, Dr. Holl. Sometimes it's very hard for them to find in motion if they have a pattern of running on their forehand. So teaching these things at a standstill, even teaching your horse to sit, which everyone thinks is a neat trick. I mean, it is, it's fun, but it actually is a fabulous way to limber up their lower back. So Dr. Holl, was that what you had in mind?
Exactly, and thank you, because here's the thing. Again, it comes down to active range of motion, having the equine do the work, learning how to engage the pelvis, learning how to engage the front end on their own, because the more they are actively moving their joints, the healthier they will remain because of the receptor activation. And so maybe we all don't have the expertise to do the things and have the training that Farah does, but you have Farah, right? And so she's a tremendous resource for us. So if you have some ideas or questions, reach out to her, take a training, take a course, involve yourself, because boy, oh boy, we don't want our horses to just live long, right? We want them to live long well. Right? We don't want to just live to be 95. We want to live to be 95 and being able to jog around the block. So it's a question of living long and living well. All right. And so that's about movement. And if I could just talk a little bit about neurology, would that be okay?
Yeah, I just want to toss in, I do see a human chiropractor, and he constantly is telling me, Andrew, you got to move. You got to move. You got to find a way to move. And oh my gosh, this is really driving home, seeing it even from the horse perspective, why we need to do it as people as well. And then obviously getting our horse to move. Wonderful.
That's a good point. I will tell you how many times, and I've worked on thousands and thousands of horses, how many times have I worked on a horse and they have a lumbar, a thoracic spine, a mid back that's very, very stiff and rigid, and the rider has a hip problem, right? The rider has a knee problem, and so the rider is not symmetric, right? The rider's not sitting, squarely on the horse. So there's a unilateral burden on one stirrup, or one side of the stomatognathic, which is the jaw, and the TMJ.
Mhm.
So really keep yourselves healthy too.
Keep ourselves healthy as well, right? And
I am
keep
a
our
human
movement.
chiropractor too, so usually it's my patients are kind of limping into the arena with their horse, asking me to work on the horse, and I often say, well, guys, what about you? But anyway, let's just talk a little bit about just a little more neurology, because neurology is sort of the final thing that I want to just mention, if I may. Do we have a little more
Yeah,
time?
go back to this. Yeah, go back to the slides. We're doing great.
Okay, so are we on the slides now?
Yep, I see your. Let's break it down through neurology.
Okay, for some reason it's not there we go. All right, so the nervous system. The nervous system is the master system. It's the boss. So what is the nervous system? The nervous system is the brain and the spinal cord. And why is the spinal cord so important? Because it sits inside the spinal column. And where is the spinal column on the horse? On the back.
Mhm.
And what happens? Well, we sit on that back. I'm going to skip over these because there are a couple things I want to say. First of all, the brain and the body are indissoluble union. I mean, the muscles, they have all the receptors in them, the joints, and they communicate this to the brain. So everything that goes into your brain, everything that comes in is sensory. You smell something, you see something, you hear something, right? Everything that goes out of the brain is motor. So if you hear a really, really loud noise, and that's a sensory input, and it goes to the neurons in the temporal lobe of the brain goes, take your hand and plug your ear, right? So the brain issues an instruction. Right. You go into a really stinky arena, and a bunch of cows, and your nose says, wow, that's stinky, it's sensory. And the brain says, wow, take your fingers and pinch your nose closed, right? So it issues a motor instruction out. And so the brain and the body need each other. It's super important. But I want to get to something. Let me just jump on this because we just talked about this. Forgive me if I'm jumping a little bit, but I just want to get to Dr. Roger Sperry. He was a Nobel laureate, and he did a lot of work on hemisphericity and just really some cool stuff. But he said the more mechanically distorted your body is, the less energy you have for healing, for metabolizing, and for thinking, right? The more mechanically distorted. What does that mean? The more stuckage you have, the more your brain is going to be impacted. And he wrote, and he was a Nobel laureate, right? And he demonstrated that 90% of the energy that goes to the brain, of the information that goes to the brain, comes from the spine. 90%, Nobel laureate. What does that mean? That means that 90% of the stimulation and nutrition to the brain is generated by movement of the spine, right? And why is that the spine such a big player? Because the spinal cord's right inside of that, right? So what do you think happens again when even if you're 90 pounds, but when you're sitting on an equine spine, or you put a small saddle, even the smallest of saddles, right? I mean, and I'm not saying that's a bad thing. I'm just saying, knowing that, we can do something to fix it, right? So,
Cool picture.
Less neurons, less motion, and the neurons in the brain are activated less, all right? So less information. So I just want to sort of mention, let me go right to this slide. This is a cool slide. So can you see my mouse?
Is that, your mouse?
Yeah, can you see my little arrow moving?
Yeah, it's just below the dog.
Okay,
yeah.
So, all right, so we said that incoming information to the brain issues outgoing information to the body, right? So let's just say that this little guy has a stuckage in his neck, right? So instead of getting 100% of the information to his brain, sensory, because the receptors, that stuckage is causing him to have only 70%.
Mm.
So then the brain can only issue 70% of the motor information out. And that's why we get lameness. Does that make sense? Because I can repeat
Wow.
that.
No, I
Right?
hadn't,
And
had
very,
not
very
thought of
common.
that.
Very common. So there's a stuckage in the neck in this case, which there
Mhm.
was, right? The brain is only not getting those receptors because they're stuck in the joint. So the brain says, okay, I have 70% here. Here's 70% I'm going to give you. So you can imagine now why racehorses, every racehorse professionally has a chiropractor, because if I get 100% of information, I'm going to reach further. I'm going to run faster. Remember, motor output, right? Depends on movement. So I just want to talk about, we don't have to get into the receptor activation. My slides are very verbose because I am, but anyway, you move the body, it tells the brain about it. So do you remember in the beginning, I was talking about physical deformation of tissue when we touch something, it changes the neurology. All right. Have you ever come home from work after a long day and someone just comes up to you and rubs your shoulders? Right? That feels good.
Yes, it does.
Why does it feel good? Because something is happening. And that's all the gate control theory. This is actually by Meltzock and Wall in 1964. They figured something out, that in the spine, all right, and not just the human spine, but the equine spine, the canine, the feline, the bovine, in the spine, right, there is a gate, a neurological gate. And when we experience pain, that depends on whether or not, that pain can get through a gate. All right. Forget about all this. Let me just get to I'm going to jump around. All right. So we hurt ourselves, right? We smack our hands against the wall. I was talking about this last night. You smack your hand against the wall. What's the first thing you do? You touch it after you cuss. You touch it, right?
I'm gonna
You
hold on
hit
to
your
my
head
hand.
against the wall, you touch it, you rub it. And so what happens is when we smack our heads, we're stimulating small diameter nociceptors. They're pain receptors. Every time there's a stuckage, we're stimulating, there's nociceptive input. There's pain input. And we don't really realize that pain because only 80% of that pain threshold gets to the brain. So we can live in the presence of pain without experiencing pain for a long time, right? But let's say we have an acute pain and we smack your head against the wall and all of a sudden you have pain receptors opening that pain gate and we experience pain. We immediately put our hand there and we rub our heads. That rubbing, that physical deformation of tissue stimulates large diameter mechanoreceptive input. I know that's like a long thing to say, but with movement, you override pain, right? When you rub a horse's back, you override pain. When you rub your shoulders, you override it because you're affecting yourself neurologically. So the next time you're at a party and you hit your hand against the table and someone says, oh, did you hurt yourself? Because you're rubbing it, say, no, I'm just stimulating my large diameter mechanoreceptive axons to override the small diameter nociceptive input to shut the pain gate.
Well, it's easy for you to say.
Because that is what you are doing. So every time we touch a horse, whether it's massage, whether it's mobility, whether it's balance, whether it is motion, right? Acupuncture, chiropractic, we're stimulating mechanoreceptive input. We're stimulating neurology. Every time Farah asks her horse to stand on 3 legs, right? The brain immediately is saying to the other 3 legs that are remaining on the ground, wow, you guys better support this body. Let me issue motor control to you. Right? Let me throw out all this motor response so that you can balance. So the brain is working harder so that it is healthier. Does that make sense? And that's the crux of what we're talking about. It's about movement, it's about balance, it's about health. And that is why instinctively, forget about all this stuff, but instinctively we touch a painful area. We all do it. We even notice our babies, our grandbabies come into a room, we know they hurt themselves, we know to rub it, right? Why do we know to do that? Because we know neurology, because instinctively we're functional neurologists, and the more you touch your horse, the more you move, and but more importantly, as Farah said, the more you allow your horse to move its parts independently and on its own, the healthier that horse will remain. And you'll have a really great horse for a long, long time. So let me just see if there's anything else, because I'm sorry about all this, but, and so as a
but let me stop you for just a second, because I'll let everybody know, on the call, we had a prep call yesterday, and we were talking about touching the horse. And just as we get benefit from touch, as you're giving us the medical reason why, how we touch our horse matters. And Farah, could you talk about, because I know that I learned in my natural horsemanship time that patting the horse or hit it, which is essentially like, I'm not enjoying that. I'm enjoying this a lot more. And if I have somebody doing this, it's much better. Can you expand on that, Farah? And then maybe we can get the doctor to explain why that is.
Yes, actually, Andrew, that is we did have a great conversation about it yesterday, and I'm glad you brought it up again, because it's strange, but I give quite a few lessons on how to pet your horse. And I know that sounds crazy, but first of all, if you don't enjoy it when somebody touches you, it's kind of meaningless. Yes, your horse should not freak out when something whacks them by accident. But the truth is that not just forcing your horse to tolerate things, but if they enjoy 99.9% of the time that you're touching them, and you're touching them in a way that you would like to be touched, like, in a massage, or, smoothing your hair, or something that not just what you're doing, but how you're doing it and what you're thinking while you're doing it, right? Like, I love you so much. I want to make sure you're okay. I want to touch your tendons and your joints and your muscle and your bone and your soul, that you really put your heart in your hand and rub your horse, right? So I do believe that there is a quality of touch. And even though we're just horse owners, and Dr. Pat can explain this in detail, why it works, but horses, it's not just about the physical, I am touching the horses, it's the emotion behind it and the reason behind it, and then the way that you're doing it. I actually gave a lesson to a cute little Appaloosa yesterday, and the girl was, she said, I think this horse really loves people, but she's very spooky about new things. And so I've been trying to desensitize her. And I said, okay, well, give me an example of what she's spooky about. And so she was kind of tossing the rope around her head, around her ears. And she said she only lets me touch up to her forehead. And so I just took a little time and I just massaged her head and her forelock, and pretty soon I was touching her ears and pulling on her ears. And I said, just for a while, make her, because she actually did have some fly bites and things in her ears. That was a good reason to be sensitive of that. So just make her a promise that you're going to be careful about the way you touch her ears, and she will let you. And she let me touch her everywhere with a plastic bag at first, that she was totally worried about, because she trusted that I wouldn't touch her in a way that was hurtful or felt wrong, or something like that. She made so much progress just from the way I was touching her. So I think that was what you were bringing up, Andrew.
Absolutely. Yeah. Absolutely.
I want to just jump all over that, because vibration is everything with the equine. They're prey animals, let's not forget, right? And they were born to flee. I mean, that's how they survive. And vibrationally, I think I even mentioned it last night. I mean, how you approach a horse, how you look at a horse, how you smell, how, you know, what you're wearing. If you don't think that they notice all of this, they do. I love watching Farah's mother, Echo, approach her horses, because she generally starts singing to them long before she gets to them. And it's, I always let her go in front of me, because the horses immediately start nicker and, I want to say, what's the little, anyway, they make the pretty little flutteral sounds that they make when she comes out to them, because she's singing and they know she's coming and they love her. And that's all about vibration. And it's all about sensitivity and touch. And yeah, I mean, we can bring it to our own lives and say, we love to be touched and loved and be gentle, to have someone be gentle with us as well. And we're not prey animals.
Right. We're the predators. Yeah.
We're predators. So let's remember that. There's a wonderful book. I think it's called The Hidden Messages in Water. I don't know if anybody ever knows about it. It's a real tiny little, 6x4 book. And it was written by this Japanese man, and he took photographs of molecules of water. And he would sing to them and photograph it, and then he would yell at them. And you would see the necrotic, sinking of a molecule of water in his photographs. I encourage everybody to look for this book, because it's exactly what Farah was just talking about. And that when he would sing to them and tell them how beautiful these molecules were, I mean, they just became colorful and expanded.
Wow.
Like lotus, it's extraordinary. And you can't really dispute it. And so I believe it's called The Hidden Messages. I always call it The Miracles of Water, but that's not the name of it. I think it's called The Hidden Messages of Water. But so check that. So vibration matters. Vibration is movement, right? It's communication. It's communion, and that's what we're just trying to do. We're just trying to make each other healthy. Isn't that what we're doing? I heard someone say the other day, don't think about your health now. Think about the health of the future you.
Oh yeah.
And that to me was so much more profound. Not if I think about my health right now, okay, I'll go for a run, I'll feel good. But if I think about the health of the future me, I'm going to be eating better. I'm going to be exercising. I'm going to be like, when I'm 75, I want to make sure that future me is really, really healthy. So I think it's something that we can apply to our horses as well. Anyway, so let me just finish up here. Chiropractic, right? Better understanding of neurology helps us understand movement. Just a couple more things to ponder. We'll skip over neuroplasticity. I could talk about that for hours and hours and hours. But I do want to say that, nerve pathways and patterning, what Lisa was talking about last night, that, a horse that's lame for 6 months starts to believe that that's a normal thing. We have a sprained ankle for a long time. Even when it's no longer sprained, we're walking funny. So whenever I adjust a horse, I always ask it to kind of lope out, so that it can start to realize, hey, I can reach again. I'm not stuck anymore. But I just want to say, we talked about stretching. Farah talks about that a lot. Massage or some other principles that we can do to really water therapy. I mean, if you have access to water therapy as a human, for yourselves, for your dogs, for your horses, really a great aquatic therapy is paramount. It's so beautiful. Dry needling, acupuncture, again, we're going into that tissue. These are some other ideas. And of course, chiropractor. You want to find it and by the way, do not just go to a chiropractor. Make sure your chiropractor is certified nationally, internationally. Make sure they have the letters after their name, because training is paramount. But the last thing I just want to mention is why are our horses, how and why our brains are different. The human cerebellum, hang on, let me back up a minute. is pretty small compared to the equine cerebellum, and the cerebellum is where we balance, right? And that's why when you see a baby horse, that horse is fully precocial in 24 hours. Why is it fully neurologically developed? Because in 24 hours, that horse has to be able to run for its life if needed. So a baby horse, and whenever I see a mother horse with a baby horse running, I stop my car and I get out and watch, because that is a miracle to me, because it takes us how many months to stand up?
Pushing
Right?
a year or more,
A
right?
year.
Yeah.
And a baby horse is running at a full clip because it has a full neurologically developed cerebellum and brain system in 24 hours. And I
Mhm.
think that is really fascinating. So we owe it to them. They're ambassadors of magnificence. I don't know how else to say it, the equine, and we are privileged to share the planet with them. So a little bit of understanding of neurology, a lot of bit of caring, and perhaps stretching and attending some further training, maybe with Farah or somebody in your area that you can do, is just going to go a super long way. So I'm going
Wonderful.
to by the way, the last thing I do want to say is, how do you know if your horse might
Oh,
be-
yes, please do, because we want to think about, can we assess a problem with our horse?
Yeah, so obviously lameness is an easy one for us, right? We all know lameness, but if your horse isn't taking the left lead, that might be something, right? If they're bucking, if they're cinchy, if their ears are pinned and their eyes are like planets. When you put a saddle on, you might know something is wrong, right? If there's changes in diet, if they're not eating, if they're eating, and as you're the people that I really don't need to talk to, because you guys are you care so much for your horses. You can tell if the horse's left eye is moving a little faster than the right. You guys will know, that I need to do something. But obviously decreased performance and change, any changes. Those are the things that by the way, this video, little picture on the right, the horse and rider were okay.
Oh, good.
Yeah. But look on that picture on the left. When we barrel race, we're asking a lot of the equine spine, wouldn't you say?
Mhm.
I know you guys don't barrel race, but anyway. So I'm just gonna jump to the last, because remember
Yeah,
the
we
importance of
want to
movement.
make some time for questions, and I'm
Yep.
yes, I'm ready. Yeah.
So there it is. I'm done. And questions or whatever, Farah, if you want to add anything now, and
Well, I didn't mean to interrupt you, because you said finally. Remember the
Finally.
importance of movement, right?
yeah, a little maintenance goes a long way. So find a really good chiropractor in your area, somebody who's certified. Really get a trainer like a Farah in your area, and you've invested in this beautiful member of your family. So provide the additional things that will just enhance longevity and enhance it well.
Well, that's awesome, doctor. Thank you so much. I do have some questions lined up. We have Laura has a 22-year-old quarter horse mare. She's recovering from mechanical laminitis, MPA, severe sole bruising. She's now sound and happy, but she's recently showing wear on her hind toes and is dragging them. How might she help her horse?
Okay, so that sounds like it might be a little bit of a disc desiccation in the lumbar spine, so drying out of the lumbar discs. Do you remember what Farah was saying about weight bearing on the hind end and the pelvis in that case? So you want to engage those posterior muscles and then the rear extremities. So I would definitely get a chiropractor or a massage and a massage therapist. The dragging the rear is usually nerve interruption on some level, and the nerve interruption is usually from the discs in the spine at the lumbar spine and pelvis. So I would consider maybe getting getting some motion in there with the chiropractor and massage therapist, and then really training it to do a little posterior muscle engagement, like Farah showed you with that pelvis collection.
Oh, it's great. All right. So another one of our listeners or members here, and she has a 6-year-old mare. She bought and rescued her last year. She ended up with severe degenerative joint disease and got arthritis. Is that thing arthritis surgery? April 2019. She then got diagnosed with osteoarthritis and with it in August. Now she's fully recovered from the surgery. She's able to run. You can see it. Her C in her blood. Okay, her inflammation is on 20, which is very high. How can I help her more? I've worked on it a lot on her diet.
Okay, so severe osteoarthritis at the age of 6 is unusual. That's usually a result of obesity, overweight, or just riding burden. You don't get that bony demand unless you have a weight demand or unless you have a riding burden. Does that make sense so far? So,
Yeah.
yeah. Okay. So I'm confused about the surgery that she underwent, and perhaps let's give everybody my email and phone.
Yeah, we'll make sure that
Yeah.
that if for follow-up we can get some help with that, because obviously that's
I'm curious, actually, was it an osteoarthritis, like an OCD that was removed in the surgery?
So was it a debridement? She's saying, like, did they go in and scrape it out and clean out the joint? Is that what you're asking?
Yes, because and if she's talking about the nutrition, Dr. Holl, I actually worked in an Arabian barn, and they would have quite a few foals every year. And of course, foals are beautiful when they're fat, but they were pouring the protein to these babies so that they would get big and fat and tall. Actually, all 14 of these babies had severe arthritis in their joints, and they were luckily taken by a veterinary hospital to remove their arthritis from their joints, and many of them became performance horses. But
wow, well, that's good.
That's great.
It's extreme, but I'm just wondering if that is what the situation is and why she's talking about nutrition, and if she's talking about how can she make it, help that horse with that arthritis that it has as a younger horse. I'm not sure if that's the question or not. Who did you say that was from, Andrew?
Yeah, let me back up. It was iPad Dave Florian.
Okay, a plate and screws got placed to fuse the joint, and he's not fat, had a foal at the age of 2 and started being ridden at 3, will never be ridden again. Okay, they said they would send an email, so that's a pretty crazy story.
Yeah, that's a little bit complicated. So let's, some of these anecdotal stories, I mean, I want to address, and we'll take the time and do it personally, if that's okay.
There you go. Yeah. One person asked if a thin line saddle pad helps protect the horse's back.
So the answer to that is it depends. Because you put, I don't believe in a lot of padding under the saddle. I don't believe in multiple pads. All right. I teach at the Animal Chiropractic College down in Kansas. And one of the things that we really teach is that less is more. Like, you don't want to put your ski boots on with 3 pairs of socks, right? You just don't want to do that, because your foot does not communicate to your ski, right? It has to go through all the shearing burden to get that message from your foot to your ski. So the same thing, when you're sitting on a saddle, have a really good pad. And yes, will a liner help? It can, and it does. There's no question. But I mean, I have cowboys that are still throwing 3 and 4 blankets on, and that's just not a good communication from your body to your horse. I mean, you've seen these incredible reiners. They're almost bareback, and that, they just have to. Your horse can feel you. So just be really cognizant. And if it's a specific brand or type of saddle or pad, get a hold of me and I'll contact the people that we work with down at the college. And, because down in Australia, they're making some really amazing products. And I will say that the old cowboy Western saddle that sits over the scapula and goes down to the 18th rib, that's so much saddle. We don't need that much saddle. We just need to have enough. The English saddles are so much, they're really better for the horse. And, it's just, I'm not going to say don't use a barrel saddle if you have it, or a Western saddle, but I am saying that English saddles, they're a prime example that less is more. I mean, they're just pretty much under our body. And really, that's all we need over a horse, right? It's just
Wonderful.
between us and the body.
Cool. Somebody's asking, what do I do for a horse suspected of having shivers?
Okay, so shivers is a common thing. It is not common, but it's something that we do see. And that is something that actually the chiropractic can attend to. That's a neurologic symptom, is the horse sweating. Again, this is another kind of probably email me question, because is the horse sweating in conjunction with the shivers? And there's all sorts of stuff like shivering colic. I don't know if you guys have ever seen that. That's horrid. I'm not saying shivers is that, but that would be something I'd like to address on a sort of email scenario.
I'd be interested in just like, Sheridan from the Hideout,
Mm-hmm.
Dr.
Yep.
And she has shivers in the
Yep.
spring that is, induced by higher carbohydrates in the
Yep.
grass.
Yep. The different intake of nutrition types of
Is
stuff.
there something specific? I mean, this might not be the same case, but is there something specific that you recommended for her particular situation?
Oh, let me think. Well, again, getting motion, allowing the brain to receive receptor input, changing up the diet and having an exercise protocol oftentimes is 75% of the solution. I'm not saying it is the solution, but there are certain things, but I cannot impress upon you that, that motion of the joints in the spine so that the receptors can get to the brain. The brain gets that information. The brain's a master system. It knows what to do. It knows how much information to give the lungs and the heart and and digestive system. And when the brain isn't getting that information, the digestive system isn't getting enough information. And so everybody's on their own in the body, and then things fail, things falter.
Okay, one of our expert out in Nova Scotia says she's concerned if there's any training practices that have potential negative impacts on the horse you work on. Can you tell by their body that they're worked with things like you guys had noticed, say there's a roll cur, the hyperflexion or draw reins, or anything else? Is there some practices that we tend to use in some of our horsemanship that is more likely to cause some problems?
Farrah, you want to take that first? I mean, I'll be happy to take that too, but why don't you do you see people with
Sure, I can comment a little bit. I know what Ad is talking about, and especially restricting the horse's movement in a natural way to get a more pleasing outline for the person in the form of draw reins or, these Pessoas or lunging apparatuses, tie downs, things like this, or practicing, I guess you would call it hyperflexion, where you ask the horse's nose to go in toward their chest, past the point that they're comfortable in doing. And whenever, what I see, and I'd love to hear Dr. Pat elaborate on this, is whenever the horse is restricted from natural motion and they're held in a posture that is unnatural for them, there's always a discontinuation of circulation in that part of their body, and it shows up, you can see it in their neck, like there's a bump in their neck, or there's a bump ahead of their withers, or their backbone is protruding more, or they have more of a especially if the horse has been pulling a lot more with their front legs, they might have like a hunter's bump or a point on the top of their pelvis or their croup. So that's what I see, but Dr. Pat, please elaborate.
I want to see if I can back up on my screen here, and it's not letting me. Hang on, I don't, because I want to show you the brachiocephalicus, and I don't know why. What happened? Screen sharing. Let me hit a new share just for a second. Yeah, here. Okay, so let me back up here. No, okay, so it's not. So anyway, so what Farah was talking about, that hyperflexion, really, really challenges the poll. When you bring that chin into your chest, and we want that because the horse looks so pretty when they're walking, right? And you kind of, it's like you contracting your chin to your chest, right? And you know, and that's it. It's a, okay, quote unquote pretty look, or you know, event look, but boy, does the poll suffer. That occiput C1 and C2, those three bones at the very top of the head really subluxate, and they're really compressed into each other. So that is another deleterious sort of training technique that, you know, that's right up there with docking tails, you know. You know, it's just really can be really harmful to the horse.
So we have another one here. This is a person who's had some a car collision impact. She's done chiropractor, acupuncture, osteo, you name it. She's working on fixing it. She's doing yoga, but her neck's the most fragile thing. Is she protects her horsemanship. And even though it's getting better, she's feeling some degeneration. For her horse, is her injury affecting physically on her horse when she rides? And what might be the correlation effect in his body of her neck issue?
Okay, so is the result of her injuries, you know, the results of her injuries affecting the horse? Yes, and by the way, yes. Of course they are, right? Because you're bringing your own, I mean, a car accident, you're bringing trauma. There's cellular trauma and remember we talked about that sort of vibrational communion between us and the horse. So if we just look at that, you get on a horse and you've been through trauma. Those horses are so perceptive and so communicative, and they receive that. Now also your postural compensation as a result of your pain, all right, you're going to compensate. Your body isn't going to be free moving on the horse because of the pain. And by the way, if you haven't tried dry needling on the neck, I would very much encourage you to look into that. It's different from acupuncture, and it might be something that if you haven't tried, that might help. So just remember that everything we bring to, you know, I have a rule. It's not a rule, it's not a law, but it's really a standard I live my life by. Every day I walk into my clinic, I have to be the best that I can because my patients chose me, right? So they don't deserve the fact that, you know, I stubbed my toe and am screaming in pain. You know, they don't deserve the fact that I bought a new house and I'm stressed out. They didn't come here to pay for that. They came because they trusted me, right? So your horse trusts you. So they deserve the best that we can provide them. So if we're compromised, they're going to receive that. And I'm not saying you're always going to be 100%, but I am saying that, yeah, do the best you can with yourself. And if you can't, will it affect the horse? Likely. So then maybe help the horse, you know, through some of these modalities that we talked about tonight.
Wonderful, Dr. Holl. Just to let everybody know, from coast to coast, we're going to hit the half hour, but we're going to go a little bit over because we started a little late, and I want to give you the full 90 minutes. So we're going to be finishing up here soon. There's a couple things that I want to ask about. One is somebody's asking about a gel pad with an older horse. Is that a benefit? And then I want to ask, I'm still using an airbag pad, and I have always noticed that ever since I put an airbag pad, the air between my horse, they seem to just open up. And so do you have any comments on either a gel pad or an airbag pad?
So I'll just say what I say to every patient. It depends. How big is a horse? How big are you? How old is a horse? How injured is a horse? How injured are you? How old are you? How experienced are you? What works best? Yeah, I always like to use the analogy of skiing. I'm a skier, right? So I have gone through many incarnations of boots, skis, socks, clothing, poles. What works best for me? And I really need lightweight gear because I'm a little speed demon, right? So I like that for me. Now I ski with friends who need really heavyweight gear because that's what's best for them, right? They can purchase their grip on the mountain and they feel secure and safer. So how are my skis responding to me when I'm in the lightweight boots? They're responding well, as opposed to when I was in heavyweight boots. So how is your horse responding when you're in a gel pad versus an air pack versus, a different type of pad, saddle, etc.? Try different things. Saddle fit is super, super important, incidentally.
Yeah.
So if you have any questions on saddle fit and you're not quite sure, ask somebody you know.
Wonderful. Yeah, we do know people that can do that. And I know Farah, you can connect through for saddle fit. And how about Dr. Pohl? Do you know? Who would you connect to? You guys, can we get people connected if we connect through either one of you?
Farah?
Oh, absolutely. I mean, I have a whole saddle fitting, because I don't think it's important to sell you a new saddle if your saddle can fit the best that it possibly can. And we had some mention about treeless saddles versus versus treed saddles. I think that every horse is different. I know that's a pretty lame thing to say, but every horse is different. And if your horse is a big, strong, tubular back, like my horse that I was showing, Caesar, I ride him bareback all day and he's totally fine. And a treeless saddle is fabulous for him because he has all the freedom of movement he needs. I have had, I like the less amount of saddle between me and the horse as possible because I like to feel it, just like what Dr. Holl was saying. But I know that if a horse has an atrophied back, they are much more comfortable if you have a stable source between you and the horse. So whether it be a flex tree saddle or a tree saddle that isn't like huge and puffy away from your horse, they're just more comfortable because they don't have the back strength to be able to handle it. Just to mention too, I mean, in general, I do love my flex tree saddles because my horse can move more. However, I have had clients that have had really crooked horses, and I'm telling you, these people have improved these horses tremendously through all of the playing with them on the ground and the liberty and chiropractic and hoof care and dental. Like they do their, but these horses still, were it was very easy for them to bend on one side and then the other. And she actually said by getting a treed saddle that was well fitted, but the stability of the tree was almost like a back brace for her horse. And he ended up understanding what straight was because he was so flexible to the one side versus the other. He was actually much better off in a saddle that was more rigid. So he would learn what straight was, and he moved much better. So I don't think there is one answer, just like what Dr. Holl
Yeah,
said.
clearly it would take, you got to find somebody who's going to help you, I think is the message. But we can do that through the IHA. We can do that through some, like an experienced equine chiropractor. As we finish up here, a couple of things I want to do is remind everybody, Dr. Holl is Dr. Patricia Holl. Can you remind us your website? Because I want to make sure that we say that. Dr. Holl.
Well, I have my own, the Crazy Mountain Animal Chiropractic is on Facebook. You can get me there, but let me give you my email.
Yeah, I have it. I was just going to read the email, but if you could, so it's Crazy Mountain
Animal Chiropractic.
Animal Chiropractic. That's on Facebook.
Right.
Okay.
And then
it's Dr. Pohl, DRP. for Patricia, and then
HOLL.
HOLL@gmail.com. Yeah,
Right.
absolutely. And
And
before we close,
let me
yeah, go
give you
ahead.
my phone number too, because,
Yeah,
you know, you can
absolutely.
text me and just say you attended this. So it's 406, this is in the United States, 406-672-9116. If you have any questions, or if you do have some anecdotal scenarios that you want to discuss further, I am a teacher down at the college in Kansas, and I am plugged into like hundreds of veterinarians. I've been teaching there for 15 years throughout the country and the world, really. So we'll figure out a solution together, whatever it is.
Well, that's
If you need
wonderful.
that.
Well, we're so glad you came. And by the way, for those of you on the call, we have a membership drive discount. We call it IHA 20%. And if you type in live 20 in your promo code when you sign up for your IHA membership, that's 20% off on the most basic level. Farrah, you remind me the name of that level. That's the enthusiast, right? And that's, okay, that's the horse enthusiast. And then finally, there's a comment here at the end. Thank you for a great presentation. Not only is this good information for the animals, it's good for me as well. I'm recovering from a successful back surgery. This presentation reassured me to take the time and the steps for full motion for both my horse and me. And I can't wait to move forward. Awesome job tonight. Farrah, thank you so much for your contribution with you and your horse, your spectacular horse there. And then Dr. Pohl, thank you so much for the time. And all of you coast to coast, thanks for being here for IHA Live from the International Horsemanship Association. We thank you all for being here, and may the horse be with you.
May the horse be with you. Thank you. And the last thing I just want to add, if I may, is that
Sure.
this is not a shameless plug for the IHA. It is to say that there's it's very, very, in my experience, I've been doing this a long time, when you have fellowship, when you have a connection, when you have, some kind of a communion with a group of people who are like-minded, you just will thrive. So just consider, if not this group, some other group, but be a part of it. Invest of yourself fully, because your horse will benefit. And I tell you, after working on thousands and thousands of horses, it's those people that really are committed to the communion of each other that benefit the most. So thank you all. Appreciate you.
Awesome. Thank you all. Hey, you guys, take care. We'll see you on the next IHA Live.
Thank
Good night.
you, Andrew. Excellent.
Good night.
Thank you, Dr. Hall.
Good night.